So good morning, everyone. I'm Jessie Whittish with Kentucky Youth Advocates, and it's good to see all of you this morning. So today we are going to have kind of a follow-up conversation from last week's forum about the federal stimulus bills. And last week we talked about the bills that have already passed. And then today we're going to discuss that a little bit more, but then also talk about some of the upcoming legislation that may be passed. And so we have a staff member from Leader McConnell's office on the line with us, Megan McCain Van Kemper. And then we also have a few partners we're going to hear from as well. Thank you to all of you who submitted the priorities via the RSVP form that you were hoping to see included in upcoming federal bills. We've incorporated a lot of those into today's presentations from partners. And then we are also, pulling all of those together, compiling those to communicate with decision makers and kind of drive the work forward in terms of making sure policies that are good for kids and families during this crazy time get advanced. So just a Zoom housekeeping. This will be recorded, though we cannot record the portion with Megan's remarks. So we'll take that out of the recording, but all of the other stuff will be recorded. And everybody is on mute, and you do not have the ability to unmute yourselves. So if you have a question or a comment, please add that in the chat feature. I'm like pointing at the chat box, like on my computer. It's right here. You all have one too, a chat box. Put that in the chat box, and we'll try to address those in real time. And if we can't, Megan has already agreed to address questions. We'll send her follow-up questions. And we'll be sharing her contact information as well. So please do share those, because we know that if you have a question, other people probably have the same question, and we will want to be sure to capture those and answer those. So with that, I'm going to turn it over to Terry Brooks. And so Terry can give all of you a welcome as well, and then we'll hear from Megan. So Terry, I'll turn it over to you.
Here's the welcome. No, hey, we really appreciate all of you being here this morning. Part of what we're hearing for kids and families is that routine is important. Maybe it's just me, but I'm kind of digging this routine myself, where we know that on Wednesday mornings, voices and champions for kids across Kentucky can come together and talk about what's happening. Our commitment to you is to try to ensure that these Wednesday calls are substantive. They are addressing the most vital and current issues that families and kids are facing. So certainly as part of that, I think everybody is very aware that the federal response is absolutely essential when we think about addressing the unprecedented needs. We shared on a child care call last week with a couple of staffers from Leader McConnell's office, where we dug into child care specifically. I tried to be very transparent and share that I think the second political campaign that I was on was a guy named Mitch McConnell running for county judge in Louisville. And I remember during those days, because I'm old and decrepit, that this community was beset by court-ordered desegregation. At the time, I was a high school principal, and what I remembered was that the National Guard helped escort people to schools, that the KKK was dropping literally rocks off overpasses on desegregation runs, and that Friday night, thoroughfares in Louisville were consumed by oil cans being set on fire. Then unknown person named Mitch McConnell became county judge, and in about 6 months, order was restored, kids were protected, and the business of schooling was made a priority. So I really have never forgotten that. And our experience has been that whether it was the Omnibus Family First Child Welfare Act from a couple years ago, or the current situation, we have found Leader McConnell very responsive to both national thinking about what's best for kids, and then a rare ability to what I would call Kentuckyize it. I think that was seen just recently with a commitment of $68 million for child care support in the Commonwealth. Folks like Mike and Mandy and the Pritchard, our Pritchard partners, all were part of helping to shape that. And we found Leader McConnell and his staff very responsive. So we wanted to take that federal effort sort of to the next step, and wanted to use this morning for two different purposes. One was what is happening in DC at the moment. And secondly, his staff is always very open to also hearing from Kentucky. So joining us today is Megan McCain Bankkemper, who is the Leader McConnell's Northern Kentucky field rep. Megan, you have more than a few Northern Kentucky constituents on this call, no pressure. But we are really delighted to have you join us. Again, partners, we are so appreciative that you're on the call. So I'm going to kick this to Megan, and then I believe Jesse is going to facilitate the rest of the conversation in terms of having some partners target what's on the minds of Kentuckians that we want to make sure that Leader McConnell hears today. So Megan, welcome, and thanks for being here.
Thank you, Megan. I know you were trying to cover something there that was like both a mile wide and a mile deep. And so thank you for that great overview and kind of a preview of what's coming next. Even though there's still a lot of unknowns, I know we're really honored that you would join us today, and thank you for being so open and encouraging follow-up. Like Megan said, we will be sending out some follow-up information, including that resource page on Senator McConnell's site and also Megan's email. And we encourage you, as she encouraged you, to follow up with Megan around any questions or concerns that you have. And she's been super responsive thus far, so I'm sure she'll be really responsive to you all as well. So now we're going to try and, again, in a sharing information that is both a mile wide and a mile deep, share what we've heard from partners, and including the information that you all submitted via the RSVP form, the priorities that you hope to see included in the upcoming federal stimulus bills. So we have some folks who are going to share that information with all of you on the call. Megan is staying on the call to hear all of that. And at this point, I'm going to turn it over to Shannon Moody. And she is going to talk a little bit about child welfare. And I know that there were some questions coming up around child welfare. And I know she has a lot of stuff that she is going to cover. So Shannon, I will kick it to you.
Thanks, Jesse. And Megan, we so appreciate you taking your time to be on this call today. I don't want to overwhelm, but there is quite a bit around the child welfare piece that I wanted to touch on briefly. And it centers around kind of two items. One is around the child welfare workforce, and the other is around services and interventions within the child welfare system. So regarding workforce, we've heard from advocates actually nationally for the need for an inclusion of human service workers in any first responder funding packages. So including child welfare, adult protective services, disability services, but making sure that anyone who is on the front lines protecting kids is included in that first responder funding package. There's also an interest in hazard pay for frontline workers, knowing that child welfare workers in particular who have to go into homes and do investigations when there's concerns about child abuse or neglect, they don't have a choice in the matter and have to go into those homes and put themselves in situations where they may end up contracting the virus. And then a third component of that workforce is authorizing additional emergency funds for Title IV-E and Title IV-B programs that can support locally identified gaps. Specifically, this is for community providers at risk of closure due to the financial impacts of the pandemic, and we're hoping for additional support so that locally those agencies can continue to survive. And then specific to child welfare services, there's quite a few, and I apologize in advance for the acronyms, and I will try to do my best to make sure that I am explaining them, but they're, for child welfare folks, you're pretty well aware that the acronyms are plentiful. So the first is around increasing funding to CAPTA, the Child Abuse Prevention Treatment Act, community-based Child Abuse Prevention, CBCAP grants. And the purpose of that is preventing child abuse and neglect, including key services like state child abuse hotlines, voluntary home visiting programs, parent support programs, baby pantries, distribution of food medication for those families who are at a higher risk of child abuse and neglect. So increasing funding to that is of interest and supported by advocates. We're also looking for additional funding for CAPTA Title I for ensuring protection of the workforce and making sure that they have the necessary technology and protective resources to respond to families, to be adaptable to the situation where we're in quarantine and social distancing, making sure that technologically states are able to respond to things appropriately. In addition to the child abuse prevention, we're also hoping to see additional support for Title IV-B Part 2, which is the Mary Lee Allen Promoting Safe and Stable Families program, which basically would provide additional funding for stabilizing families in crisis, supporting foster parents, and other prevention efforts to make sure that families are remaining in their homes whenever possible, whether that's biological families, foster families. We're also hoping to see an increase in funding for kinship navigator programs to ensure access to information and resources. We know that grandparents in particular are especially vulnerable to the coronavirus. We want to make sure that there is appropriate information, resources, and access to both of those in the states so that kinship caregivers have what they need in order to maintain that placement for the child, but also maintain their own safety and health. There's interest from advocates nationally on an increase in funding for the court improvement program. We know that several courts have had to make a lot of adjustments to provide hearings virtually or delay hearings sometimes, or kind of reinvent what they're doing in order to be responsive to different timelines, and a support for technological, but then also just for staffing for the court improvement programs is being requested. We're also hoping to see an increase in funding to the Title IV-E Chafee funds to allow states additional funding to support young people in transition from foster care to adulthood. There are a lot of youth who are either in independent living or are independent living and in college who are being significantly disrupted with work potentially going away, with housing going away because they were in the dorms and now those dorms have closed. So there's a lot of unknowns and disruption to those youth who are really vulnerable to trauma in general, but also mitigating their own trauma as they continue to grow and learn. So hoping to see an increase in funding to support transition age youth. And then finally, ensuring that the FMAP rate increase is provided to the new Title IV-E prevention program. It's important because the Title IV-E prevention program is not currently reimbursed at the FMAP rate, but instead it's reimbursed at a 50% rate. And it will move to FMAP reimbursement by 2027. But we're recommending a total of 50% plus whatever is the final FMAP increase to strengthen response and intervention systems to meet the challenges of the pandemic. I know that was a lot, and I can send all of that as well, but I wanted to go through that quickly.
Thank you, Shannon. I know, mile wide, mile deep, and child welfare, of course, is, as Shannon referred to it, it's everything from newborn babies up to the parents that care for them and the grandparents and the foster parents. And then also we have so many young adults who are in periods of transition, right, whether they're in independent living or in college. And so obviously child welfare is affecting a lot of folks at a lot of different places in their life. So Shannon, thank you for summarizing that into something that was less than like 3 hours and a minimal number of acronyms. So I appreciate that. And we're gonna just have some more information about all of that coming up on the Kentucky Youth Advocates website. As we finalize our issue tracker, we're going to be kind of having an itemized rundown of some of those things that Shannon just mentioned. So just a preview of that, we will have some more information to share. So I am now going to kick it over to Courtney Downs from Kentucky Youth Advocates to talk more about juvenile justice, which is a sector with slightly fewer acronyms. And, but also we're talking about kids and families within that as well. So Courtney, I'll kick it to you.
Okay, thank you, Jessie, and good morning, everyone, and thank you, Megan, also for being on the call with us today. So as the federal, state, and local governments continue navigating the appropriate responses to those most impacted by COVID-19, it's really crucial to remember the significant impact that's had on young people who are either involved with the justice system or currently incarcerated. National partners have been advocating for the allocation of $100 million in federal emergency appropriations for the juvenile justice system, and the money would be used in the following 5 ways. So first, we want to ensure that there are adequate testing kits, cleaning supplies, and preventative supports to ensure the continued health of every young person and every staff member who is working or residing in a secure facility. So if you have ever been in a secure facility, you know that the vast majority is comprised of shared spaces. So these kids are eating together, they go to school together, they're spending their downtime together. There are shared phones, and in the best of situations, they share a room with only one other person. So it is not an exaggeration to say that a positive test in this environment could be catastrophic. Secondly, we want to ensure that there is funding for medical interventions for youth who are not able to go home, and then also to close any gaps in Medicaid coverage for those who have recently returned to detention. So it's important to point out that there hasn't been an executive order in the state issued that would mandate the release of certain young people from secure facilities. So when I say youth who are not able to go home, that could include young people who are in detention for status offenses like running away from home or other nonviolent or low-level offenses. Third, we want to ensure that there's funding to extend distance learning and also remote therapy in secure facilities. So right now, clinicians, teachers, and volunteers are no longer allowed in any type of detention facilities in Kentucky. So this is an obvious interruption of the kids' education, of their mental and behavioral health supports as well. And those are all things that are vitally important to every child right now, not just those who are incarcerated. So as we continue to navigate the challenges that are presented with this new normal, we want to also ensure that access to these services can be sustained. Number 4, we want to ensure that probation has the training and the equipment that they need to provide remote-based services. So this includes home incarceration, essentially. And finally, we want to ensure that all of the costs for any interventions are not passed on to families. So if the intention of incarceration or other involvement with the justice system is at least in some part, to rehabilitate young people, then we need to ensure that we don't create barriers to those supports by requiring families to bear the cost. This is especially true for families who are not financially able, which has likely grown during this outbreak. So Leader McConnell has been a champion for young people who are incarcerated, who are involved with the justice system in some capacity, or who are at risk of involvement. And we most recently saw this by his leading the reauthorization of the Bipartisan Juvenile Justice Delinquency and Prevention Act of 2018. So we would ask that Leader McConnell continue to be an advocate by including funding for juvenile justice in the next stimulus bill.
Right, thank you, Courtney. That was a very nice, succinct summary of all that. And I think it's so important. So often when we think about juvenile justice and juvenile detention, we think of those kids in those detention centers. And thank you for bringing up, what happens when those kids then go home, especially right now when those families weren't expecting it. And that sort of segues us to our next presenter, which is Mandy Simpson from Metro United Way. And Mandy is going to talk more about kind of like family economic stability. So what are some of the basic financial supports that families need to get through this tough time? So Mandy, I'll kick it to you.
Thank you so much. And Megan, our sincere thanks to you for joining us this morning, and of course to the leader for his extraordinary leadership in these unprecedented times. We were really happy to speak with some of your colleagues last week about childcare, and I'm glad Mike is on the call today to dig into those a little further. I am grateful to lift up some interconnected priorities for stabilizing children, which I'll do at a very high level, and look forward to the many experts on the call weighing in and the chat as well. Starting with food insecurity, we're tremendously thankful that the CARES Act provided the really essential dollars to cover the exponentially increasing SNAP enrollment, which here at home in Kentucky rose 6% in March alone. Those funds are a lifeline, but we're still seeing dramatic increases in the number of children and families who can no longer secure the food they need in this crisis. We know nonprofits in our region have experienced up to 20-fold increases in the food needs that they're working to meet. Many are trying to piece together resources to go from serving just one meal to serving 3. And there are still gaps so great that nonprofits that have never had food access as a part of their mission are trying to cobble together operations to mobilize additional support, and still it's not enough. We need the layers of philanthropic and public support in order to scale a solution and ensure families have food on the table. We know a temporary increase in the SNAP basic monthly benefit is really our essential lever here. When we consider what would meaningfully stabilize families, meaning that they can have food for everyone in the household to eat, and any modest remaining resources for other basic needs, including housing and utilities, for which there's not as readily available of an assistance vehicle. We're looking at about what we'd advocate for is really a 15% increase in that basic monthly benefit. Again, this would be a temporary measure needed to ensure that the life rafts that already exist are really able to reach and buoy everyone that's in the water during this crisis. And just to lift up one other consideration, at Metro United Way, we work with 900 corporate partners who help us to care for children and families. And we know that this investment is vital to them as well, because we know SNAP is one of the fastest and most effective forms of economic stimulus, which we really saw play out in the Great Recession. So again, we would ask Congress for a 15% increase in the basic monthly SNAP benefit in what could turn out to be a 4th stabilization bill. Shannon touched on this next issue, and I'm going to take a little broader scope for that consideration while underscoring her ask for it to apply to child welfare functions, and that's FMAP, the Federal Medical Assistance Percentage. With increased job loss that we're seeing across the country, and the potential of unemployment here at home in Kentucky, with the potential to reach 15% by summer, coupled with just the dire need for medical care, we are, of course, experiencing a spike in Medicaid enrollment. 3.1 million Kentuckians were previously on Medicare, and we know 100,000 joined during the Great Recession. We expect our numbers to actually eclipse that in this crisis. Simultaneously, state budgets are experiencing mounting fiscal emergencies. And in Kentucky, we're confronting that challenge with a rainy day fund that has about the equivalent of 10 days of operating expenses in it. So we know we don't have the ability to respond to growing expenditures without cutting vital services needed for us to have a shot at recovery on the other side of this crisis. We do, however, have a few opportunities to ensure state Medicaid programs can continue providing the critical health services to children and families. In the immediate, that would look like an additional 6% in the Medicaid match rate while preserving the MOE protections, of course, enacted in the Family Cares Act. Thank you for those. For essential continued support, we'd really be asking for FMAP increases to scale based on the extent of the economic downturn, which is very difficult to predict at this point. But this would allow the state FMAPs to automatically increase if unemployment rates raise above what they currently are and more than currently anticipated. And then to really truly stabilize our children and families and communities and the state, we would need FMAP increases to continue until the economy has truly recovered as measured by the latest unemployment data. This is again, just a critical component of our ability to recover. So that would be in the next potential stabilization package, a 6%, an additional 6% increase on top of the 6.2 in the CARES Act, and then a consideration of in the long term, how do we design this assistance to truly mitigate the impact that we're feeling in the crisis and allow states not to have to make cuts that will continue to keep us in a painful reality. And then lastly, just want to lift up a reality that we're impacted by every single day, which is that we are all only as safe as the members of our community who are most at risk. That means that we have to look closely at the supports and care accessible to our most marginalized community members. Our partners working with our homeless individuals have emergency needs of homeless prevention funds for rent and utilities that can keep families in homes and landlords whole during this crisis. But we know some have already entered a state of homelessness. So they also are desperately in need of short-term shelter care and case management resources for those who are entering this world anew and in the middle of crisis. I'll also talk a little bit about our mixed status families, which are facing what feels like an impossible choice between the present and future well-being of their children as they weigh the potential impact of public charge considerations. So we would be grateful to work with you and the leader on what possibilities might exist to prevent any Kentucky family from making a decision right now that's not in the best interest of their children, their neighbors, and our community, because again, we are only as safe as our most at-risk community members. And then we know the critical importance of understanding how, where, and to whom we're providing services during this crisis. Data collection is difficult at this time. We are nonprofits. We know and feel that. But we also know it's imperative to understand if we're serving our most at-risk vulnerable populations, because again, that's the ceiling for all of our safety. So we would encourage Congress to consider what it might look like to act upon the data that's collected and to provide the resources to support numbers that would illuminate what we may not know right now about how we are supporting every person in our community.
All right, thank you, Mandy. That was, again, a really large summary, and I appreciate you running through all those items, and thank you for underscoring that we're only as strong as our weakest community member, and we're only as safe as our most vulnerable community members. So that's just a really important reminder for all of us. And as Mandy mentioned, there are a lot of nonprofits filling a whole lot of gaps right now in terms of meeting family and community needs. And Megan already referenced this in her remarks, just around the supports for small businesses. And that includes businesses that are, all of us at nonprofit organizations. So I'm gonna kick it over to Doug Schofield from Volunteers of America Mid-States. And Doug is going to talk a little bit more about what this means for our sector from a business perspective, and some pieces that we hope move forward in upcoming legislation.
Terrific. Thank you, Jesse and Shannon and Terry and all of the KYA team for all you do and for bringing us together. And particularly thank you, Megan, for being on the call and listening to all of our input. And thank you so much for all of the leader's work and his accessibility and all of the really hard work you're doing on this. And particularly on the Child Care Center announcement and funding. That's tremendous. And for us, that's a little bit of a jumping off, I think, in talking about some of our needs, which Shannon mentioned, and are really very workforce oriented. And they're about folks in human services organizations and in behavioral health. We're really on the front lines helping every day with our most vulnerable populations, whether it's in nursing homes and senior centers, or whether it's Volunteers of America working with adults with developmental and intellectual disabilities, or working with pregnant and parenting women who are working to overcome substance use disorder. It's a real challenge for us to keep our workforce safe and healthy and caring for people. And when we think about the next stimulus and what's helped us so far and what could definitely help us more, it's thinking about those very specific ways that we can support our workers, that we can keep healthy people in our homes and in our facilities, and that we can support a workforce that might not have a whole lot of overtime pay, sick pay, hazard pay. What can we do to keep our homes staffed with those caring, competent people who are being supported? So I think there's a couple specific things that we would look to that really go across the human services sector as we think about more help in the next package. And Shannon mentioned it, and certainly hazard pay is really right at the top of that list, finding a way that we can fund our increased expenses, whether it's more overtime or whether it's keeping people healthy and just keeping our places staffed. Hazard pay is really helpful for that. Thinking about those supports, we think a Medicaid carve out would be an important way to do that and to help us keep our healthy and talented and capable people in homes serving people. So workforce support is really important in the human services sector. And kind of a bottom line for that is looking at Paycheck Protection Program and the requirements around that. We're an organization with just over 500 people. We have about 650 employees. So we're not eligible for PPP. There's a lot of similarly situated organizations. And we're not at that employee level because we're a huge organization without the same challenges that any small businesses face. A large part of that reason is because we have people in homes around the clock, and that is a large workforce. We're not unique in that. A lot of the challenges we're facing can be solved by Paycheck Protection, and we really hope as a top priority that looking at the fourth stimulus and the fourth package, that level can be raised. And it's really, I think, in many ways kind of an arbitrary number, that 500 number, when you look at nonprofits. It might have some logic from a for-profit business point of view. It's really that definition that comes more out of the Small Business Administration. We would hope that anybody that's defined in the tax code as a charitable organization is eligible for that funding. That would help us tremendously to keep people caring for the most vulnerable in our community. So that's really a top priority for us. And then in a larger sense, just looking at nonprofits and what they're eligible for, including the emergency disaster loans from SBA. We know nonprofits have been encouraged to apply even for some programs that they might not typically be eligible for through the SBA, but we would just hope that any grant and loan that is looking to support businesses is expanded to nonprofits as well. We have the same needs. We really are on the front lines. When Shannon talks about treating all of our people from being in nursing homes to addiction recovery centers as first responders, we really are. And we want to meet all those criteria. And it's been a tremendous effort to try and get that money to small businesses in need. We really are in that category. So we would urge all nonprofits to be included in that as well. And one last thing I might ask is we're certainly looking at personal protective equipment because of that. That's a shortage and a need and an expense. And anything, whether it's through specific Medicaid language or another carve out that says that there's some funding that we can use for those items and that is assistance in getting those items is helpful too. That's our need. We hear about it every day, but we see it every day as well. So we've got a great workforce out there doing the hardest work. Everybody on this call, they really are first responders, and whether they work for an organization with 50 employees or 550 employees or 1,000 employees, the PPP can really be a difference maker. So we really urge that change to be made, and that looking at nonprofits as a whole for all that help, because we've got people really working hard, and we want to keep them safe, and we want to keep them serving all the people in need that we can. So again, thank you, Megan, for listening, and thanks to everybody for being on the call.
Thank you, Doug. That was really a lot of info there, and talking a lot about those businesses that are kind of in the gap, and we appreciate that. I'm going to now turn it over to Mike Hammonds from Learning Grove. And Mike, we've talked a lot about childcare and the childcare sector, and some of what Doug said would apply to childcare providers, but I didn't know if you had anything you wanted to add around childcare centers as employers as well.
Thanks, Jesse. Well, first of all, I want to thank Megan for being on the call and thank her for her support of the childcare industry in Kentucky and the children in Kentucky. We've worked with her quite a bit since she's been on the staff, and she's incredible. She's smart and she cares, and she represents the senator well. We had a particular issue that she was able to help manage and work for us. So Megan, thank you very much. Also want to extend, as others have, the thanks to the leader for his bold leadership in addressing the coronavirus, but also his caring leadership. It was good to know right off the bat that members of Congress and the leader particularly saw this issue was going to affect Kentuckians or members, people from all over the country in varying ways, not just one sector. So that's been rewarding, and the fact that we're on this call kind of is a test to that they continue to look at where there are gaps in reaching folks who need it. The childcare industry is a fragile industry. It's a public-private partnership. Childcare providers, for-profit and many non-for-profit, provide the service that is funded by the feds in the state, but it's a very low margin business. It's critical to our workforce. It's critical to preparing kids for school and for life. But it's fragile, and it's been under pressure for a number of years, and it's even under more pressure, obviously, through this virus. We had to close our centers, and even though we were able to apply for a PPP loan, it didn't cover all of our losses. And I'm sure that there are many other providers like ours that it did not provide cover the losses. We appreciate that, though, and we would recommend, frankly, to follow up on Doug's suggestion that PPP the funding be expanded and be allocated specifically, some of it allocated specifically to nonprofits and to childcare centers. I know centers in Kentucky that have more than 500 employees that weren't able to access it. And again, they're providing a critical service under a thin margin, and they need that. So I also appreciate the specific funding that Megan mentioned in the beginning that went to the child care program in Kentucky. That's going to be very helpful. We've been in conversations with Sarah Vanover and the cabinet secretary to apply that money to help the centers that have had to close and are losing money, with the point of trying to be ready, not only to provide emergency services. And Megan, we're providing emergency child care in Treasure House, the center that you toured with us. But not only the additional cost to those programs that we're seeking funding from the state to help overcome, especially with the cost of staffing. Hazardous pay is critical to do that, and actually to provide that care to more families, not just to those in the lower income bracket, is critical. So we appreciate that funding, but more funding is necessary if we're going to sustain this industry, this very critically important industry, and have it ready to operate when we all go back to work. So thank you, Megan. Thank you, Jesse.
Thank you, Mike. And just a shout out for a recent podcast, I think it was now 2 podcasts ago, with Mike and Sarah Vanover. If you want to learn more about the childcare industry, that's a really great podcast that goes in depth as to what's been happening within that, and then what's coming, or what will hopefully be coming down the pike. So I'm going to kick it back to Megan for some final remarks from her, and then we will wrap up. So Megan, I'm going to kick it back to you. Thank you, Megan. And just as you were talking, we got some numbers around child welfare and child care, and we'll communicate those to you in follow-up. So before I kick it over to Terry for final remarks, I'll just say that we are going to be having another one of these conversations next Wednesday at 10, and that will be around health care, health access, and health equity. So be on the lookout for that in the follow-up email. So Terry, I'm going to kick it to you.
Yeah, well, just again, thanks so much for all of you joining. What we do want you to know is that we see these Wednesdays as a time to virtually connect, but it also, I hope that you agree, we also see it as a time for action. I can tell you that the partners that we had been working with, as an example, on childcare, really did make a difference in how things came down. What you have our commitment to do is to make sure that we fully hear what numbers you're talking about. For instance, I know in separate communications that I had received from Jennifer Hancock, that at least VOA has some budget estimates on what they believe is important for those workforce issues. We've also heard additional numbers. So I'm going to rely on my KYA colleagues to make sure that they're doing the appropriate outreach. We want to be able to, I think we would all agree the worst thing that Leader McConnell can do is to get conflicting or widely different estimates on what we need on this front or that front. So I do think that we want to be very intentional, very united, very focused on a response on those kind of questions. The other thing that I would just want to say is that we hope these Wednesday calls increasingly become community property. It's not just up to us to decide what needs to happen next. Candidly, right now, the struggle that I'll say I have, maybe my colleagues don't, is how do we plan ahead and yet simultaneously respond to emerging issues. So I'll give an example of one that we know has sort of started popping up really in the last few days, which is hands. There are increasing concerns around how that's going. So what I would want you to know is that we're trying to think about how to do both of those, how to put together these Wednesday calls in a substantive, orderly way, and yet understand that the landscape changes. What we think is an issue today, there may be another one that pops up. So again, what I hope you hear is that we want to hear from you. We want these to be valuable. And the only way those can be valuable is for you to give us guidance, feedback, what's working, what's not working. Because I think we're all learning this virtual world in terms of process as well as topics. So thanks so much for all of you who presented today. Thanks to those folks who were so important in having Leader McConnell get on the call. And, again, thanks for hanging in. Thanks for being voices for Kentucky's kids. And I hope we see all of you next Wednesday. Spread the word. Let's grow this virtual town hall meeting. Okay. Be safe and take care. Thanks, Jesse.
All right. Thank you all. And looking forward to seeing you next week, if not before, and be on the lookout for follow-up from us. Thank you. Bye. Have a good rest of your day.